Hello everyone. Today we have a Dr. Kanna Amarnath. He having a total 22 years of experience. He is currently working as a principal in Ahmedabad Medical Institute of Science. So let's start with the interview and introduction. So please kindly introduce yourself, sir.
Good afternoon. My name is Dr. T.KannaAmarnath. I have joined this institute right from 2006. You know that first next to civil and SBB College of Physiotherapy, our college is initiated in the private sort of thing, affiliated with Gujarat University, and even it is recognized by IAEP, and recently it is even recognized by Gujarat State Physiotherapy Council. And later, after a few years, I became a senior lecturer, and later I became a vice principal. And last 2 years, I'm working. They have promoted me as a principal by the blessings of God and my chairman and my colleagues. So because of all their, teamwork, I'm here. Everything is going good.
Great, sir. So let's beginning with the interview, sir. My first question is to you. How do you trying to bring the practical approach toward the subjects and make it industry oriented?
Yes. First and foremost, let me tell you, we are following the Gujarat University syllabus, right? Actually, in our field, theory and practicals go simultaneously, right? The first we will teach them theory, and later we will go to the practical aspect. From the first year, anatomy, physiology, exercise therapy, biomedical physics, and in the same way, second year exercise therapy 2, electrotherapy 1 and 2, and third year it's physical and functional diagnosis, and the final year we have that all sort of neuro, ortho, cardio, rehab, and even medical surgicals. We do have all those subjects. Actually, the curriculum that itself, they are framed very keenly and precisely. The first year, they will teach you all the basic stuff, that what are the exercises you have to perform for the patients. And even the second year also, there are a lot of techniques, various techniques. The second year, we will teach them. And the third year, it's a PFD both, physical and functional diagnosis. This is the crucial part, Diagnosis is very important compared to treatment. The first, if you know what are the problems with the patients, and you can make sure that your protocol and even outcomes of the patients will be much, much, much better. So third year curriculum is very good. And in the final year, we will divide it into orthopedics, neurological, cardiorespiratory, and rehab. And in our college, the respective faculties will teach all those stuffs.
Okay.
Anything else?
Great, sir. So my second question is to you, sir. What are the best practice offered by the department to the student which help them to gain the necessary skills?
You're asking about that, practical skills, how it impact to the society in future, right?
Yes, sir.
Yeah. For example, I used to take the final year students, orthopedics, that is, specifically you can say, principles and preventions of sports injury and rehabilitations. In that aspect, I taught one thing, a Pilates concept. That is more or less similar to the yogic practices, but this one is redefined. I taught them for 75 to 80 students somewhere there. Among them, one student, Dr. Stuti Shah, she started from that single concept, that is Pilates, and she started a core tuck-in, that you can say she has opened the even branches also. You can see it in the Google if you want. And one more student, I didn't talk for that student. It's a neurological aspect. From my colleagues, they have taught about the cerebral palsy, and Dr. Harth Patel. He has opened a pediatric clinic specifically for pediatric. So by this way, there are any number of examples, or you can say from our students' side, they are helping them and they are redefining them by attending various workshops and seminars that indirectly impact to our society nearby.
Okay, great, sir.
Thank you.
So my next question is to you, sir. How do you help your student to cope up with the competition being so high in the outside of world?
It's very difficult though, but in our institute, right from beginning, from first year to PG students, we have some number of occasions like annual day functions, graduation day functions, sports day, various seminars, workshops, all those stuff. What we do, Every college they used to do this concept, but we also do the same thing. Like we will give some assignment to the students that they have to call their particular persons, arranging the stuff behind this, all those sports day or annual day function, whatever the thing they do by themselves, and we just direct them. But the overall work, they will look after everything. Maybe I think from this all those stuff they have learned that leadership qualities. That while they are doing, they themselves don't know their capabilities. Only later, after finishing the college life, that whatever that is in the subconscious mind, without any awareness, they will themselves come into the leadership, and they won the race. And there are lots of examples, and not only here. Many of them are going to move to Canada, Australia, and New Zealand, even America. I used to tell one thing that in Canada, there are mini agencies there. You just you think about yourself that many games, how many students have went there to Canada for higher educations, and later they pass out their local license exam, and they start their own clinic over there.
Okay, that's great thought, sir. So my last question is to you, sir. What are your views upon the placement and the higher education about the student from your department, or how does your department prepare the student for the higher educations?
You are asking about that higher placements, right?
Yes, sir.
Yeah, first and foremost, I will tell you one thing. Same thing while we are teaching the basic curriculum. We are following the authentic books in our physiotherapy professions. Kisner, Maggie, and Sullivan, all those books. One student went to US and he is waiting for the license exam. And that students informed to other student, whatever our faculties they are teaching, all those stuff from the authentic books, those are questions are appearing in our MCQ for their own license exam. So that gives a very good, even after I hear all those news from our students, I felt so happy that they have got the concept very clear while in the college going days. And the next thing for the placements, for first higher educations, we used to call our people over here placements, a lot of consultancies are there. Every year we used to call them, and they will give a lecture, basic lecture for our final year students. What are the procedures they have to follow, all those stuff. So that will definitely help them to move to abroad. And the next thing for the placements, what about abroad, even in our own state, our student, they become the leader. As I said before, Dr. Stutisha Bortakin and Arth Patel, he is the founder of Setu, and next is Alayam Rehab Center. Her name is Vidhi, she is working over there. So our students themselves become the leader, and they are giving opportunity for their own juniors. They are our good alumni, and we are so proud of that.
Oh, great, sir.
Thank you.
Yeah. So now I would like to conclude the interview. Thank you for such all information. It is very helpful for the all students and the parents. Thank you so much, sir.